Hello, this is Dr. David Green, CEO of the Georgia Pain Network. Today's topic is avoiding surgery for degenerative disc disease. The normal intervertebral disc consists of 80% water and then 20% collagens and other proteins. The best analogy is to that of a jelly donut. You have a tougher outer covering called the annulus fibrosus and then a gelatinous interior called the nucleus pulposus. The interior has no nerve endings whatsoever. The outer part, the annulus, does have some nerve endings, and it can feel pain when it gets degenerative and tears. The disc itself is an excellent shock absorber. As we walk, jump, bend, twist, it absorbs the shock by pushing water out, and then the water comes right back in. As it starts to degenerate, basically what's happening is the disc is losing water content. Height loss can start to occur. Pain may occur from the resulting tears and cracks in the outer layer, the annulus. 40% of the time, the intervertebral disc is the cause of low back pain, and it may lead to inflammation and irritation of the adjacent nerve roots. So not only do you have back pain, you can have sciatica too. So degenerative disc disease can lead to daily disabling pain, or it may cause no pain whatsoever. In a study looking at MRIs of asymptomatic individuals, 35% between 20 and 50 had degenerative disc disease with no symptoms. So it looked like this with the black disc, degenerative disc. These are all healthy. The white is water, and they had no pain at all. Options for degenerative disc disease include over-the-counter medications such as anti-inflammatories, Tylenol, narcotics, topical prescription pain creams, muscle relaxers, physical therapy, chiropractic treatment. TENS units can help, spinal decompression therapy such as you see in the picture here, which is computerized intermittent traction, and then acupuncture. There are several interventional treatment options that can help a lot with the pain from degenerative disc disease. One of those is trigger point injections. These are just subcutaneous injections that can help relieve spasms and aching from the muscle tissue. Intradiscal is when injections go right into the disc. This may consist of one of three varieties. Steroid medication, which doesn't fix the problem at all. It just helps relieve pain. That can work for a few months at a time. PRP therapy, which is platelet-rich plasma therapy, that's showing excellent results inside the disc and potentially some healing. Stem cell therapy into the disc can also help in small studies showing that it helps excellent for pain relief and to help restore a little bit of height to the disc. Medial branch blocks are a treatment that puts numbing and steroid medication around the joints of the back. This is not a disc treatment per se, but most people with degenerative disc disease also have arthritis of the joints of the back called the facet joints. So an injection around that called the medial branch block or into the joint called a facet injection can be very helpful. Radiofrequency ablation is when the little nerve endings around those joints of the back are deadened with thermal energy, and that can provide pain relief for 6 to 18 months. Epidural injections have been a gold standard for nerve pinching and inflammation for decades. If degenerative disc disease is causing inflammation of a nerve root that's adjacent, it can be great to help with butt pain, sciatica pain. IDET stands for intradiscal electrothermal treatment. That's really not done much anymore because insurance companies stopped paying for it because it really didn't work that great. MILD stands for minimally invasive lumbar decompression. That is a procedure where a pain doctor can remove a little bit of the disc through a minimally invasive treatment and help relieve pain from degenerative disc disease. Here's a radiofrequency ablation. You can see this is the joints of the low back. This catheter goes around the joint, gets heated up and deadens these little nerve endings and can relieve pain from 6 to 18 months. As mentioned, that does not go into the disc. Here you see a bone marrow derived stem cell treatment being processed. So you have stem cells being put into the disc, and some small studies have shown that this works very well for pain relief. Comparison of long-term outcomes for those with back pain and a positive discogram did not demonstrate a significant difference in outcome measures of pain, satisfaction, disability based on surgery versus non-surgical options. Okay? 75% of the time, patients are able to achieve a satisfactory level of baseline pain with degenerative disc disease and avoid surgery. It appears to me that those statistics are actually moving upwards, so more than 75% can achieve an excellent level of baseline pain and avoid surgery. The top non-operative pain management in Georgia is through the Georgia Pain Network. There are multiple clinics throughout the state accepting over 50 insurances and providing over 25 different treatment options with the board-certified doctors. Visit us online today at georgiapainnetwork.com and then call us for more information and scheduling at 404-850-9099. I'm Dr. David Green with the Georgia Pain Network. Your pain stops here.